So again, welcome and thank you for participating in our roundtable discussion on reopening campus recreation facilities. Right now, we have people using the chat to just type in their school name, so go ahead and keep doing that. But at this point, I want to allow our panelists to introduce themselves, and then we will get right into our first discussion topic. So Kevin, would you mind going first?
Sure. My name is Kevin Ogden. I work at Messiah College, small school in Pennsylvania, right outside of Harrisburg. Starting July 1st, my role will change to Director of Wellness and Recreation. So it's fitness center, intramurals, open gyms, employee wellness. It's an interesting position as I'm also the head strength and conditioning coach for our NCAA team. So a lot to get ready to go.
Great. Jen, would you mind going next?
I'm Jen Gudez. I'm the Director of Physical Education and Recreation at Cornell University.
All right, Chad.
Hi, everybody. I'm Chad Indorf. I'm the Director of Recreation and Wellness at Gannon University in Erie, Pennsylvania, right on the shores of Lake Erie.
And Chris.
Good morning, everybody. It's great to be here. I'm Christine Shanley from the University of Rochester. I'm the Associate Director of Athletics and Recreation. We are structured a little differently in that I work with a team of about 5 full-time coaches who oversee our building operations. I don't do anything with intramurals, but I do keep an eye on it. So our structure is a little bit different than most folks that are here today.
Great. Thank you to each of you for being willing to share your experiences today. And a quick reminder as we head into our discussion that you can write any questions you have in the chat. And we will be reading those out loud when we get to the question and answer portion of this session. We'll do our best to get to as many as possible. Okay, so question number 1, our first topic centers on the timeline of reopening that each of you are on. So do you have one set, or do you have a tentative time frame you are working toward? And Jen, would you mind leading us off?
Yeah, no problem. Thanks, Jessica. So we are located in New York State. We're hoping to get the approval on July 10th. And with that approval, we'll start with a 3-phase of opening. So we'll start with a very basic just launch and what we can do to get one of our facilities moving ahead. We do have 5 facilities. So fortunately, social distancing for us might be a little bit easier because we can open more facilities in order to make more space for people as necessary. But a light launch then, and then as we see what we can do, and we're not going to be able to have student staff. So in the beginning, it'll just be getting everything up and going, seeing how the light launches, and then moving into the next phases as the time approaches.
Chris, do you want to go next?
Sure. We really don't have a timeline, but we are working towards opening once our students are back on campus. And we've been told by the provost that we will have students back in the fall. Fall is a big time frame, and they will leave at Thanksgiving. You know, we will too start on a smaller scale. We probably will operate with hours that we currently have, which are basically 6:30 to 11 at night. But again, student staff will be a question. We may reach out to some of our coaches to help operate our facility and do some things of that nature, and then have to work creatively and be agile in order to make changes we need to make. We will be focused primarily on social distancing, working with a 40 square foot per person formula in order to decide what our occupancies are going to look like in each of our spaces. So, and that is really quite flexible. I mean, that's a standard that the university is using, but it may need to be adjusted depending on which facilities we're talking about. If it's the fitness center, the aquatic center, rec courts, those kinds of things.
Kevin, do you want to go next?
Sure. Yeah, we're scheduled to start classes August 25th, a week or 2 weeks before that start happening, especially with athletics. we're looking to open up, and it'll be phased as well. We just have one facility, so I'm looking to spread out into some non-traditional areas. I got permission to take over the indoor track, and we're going to probably limit intramurals, rec sports, open gyms, and so kind of turning one of our like rec gyms into like my spin studio. We've decided that it'll be a little bit more to give students and employees like structured, supervised, able to be distanced activities rather than trying to figure out what contact sports look like or collision sports look like without distancing. So it's kind of hard to picture that. So that's what we're doing. And then again, opening up in phases with the idea that you cardio and selectorized stuff first. And if everyone follows the rules that we've set up, we'll start opening things up again. So it's really, we're basing it a lot on member behavior. And if everyone seems to be buying into the rules and regulations, then we'll continue to open things up, but very flexible.
Flexibility is key right now. Chad, can you speak to your situation?
Yeah, we're don't have 100%. We're not 100% sure what we'll be doing yet. The hope is that we will be able to get into the building early next month. So sometime, hopefully in the beginning of July. I've been lucky enough to be able to get into the building throughout as this has been going on, just to check on it, check in the pool levels. We've been able to have a couple contractors come in and do a few small things that we needed to get done. But the hope is to be in the building, get it clean, get it set up how we wanted to in July, and then be open for our students when they return on campus in the fall. We have a shared facility with athletics, so a lot of our athletics department is housed in our recreation building, but it's run by our department. So kind of like some other people have said, the goal and the plan is to be much more restrictive when we open, because what we don't want to do is have spaces of the building open, allow certain things to happen, and then right away have to kind of reel everything back in. So we're planning on being much more restrictive on what we are allowing to happen in the building, and even days or a week, seeing that we're able to be a little bit to open up a little bit more. Then I think that's what our plan is going to be, just so we don't have to try to reel in soon after that. Everything is still kind of up in the air, but as of right now, that's kind of what our plans are going to be.
Okay, our next topic focuses on how the shutdown and reopening process has affected your budget priorities. Obviously, so much is different now than what everyone was planning on. So how have you had to adapt your plans in light of COVID-19? Chad, if you want to actually go first, we can boomerang back around.
Yep. So we don't have our budget yet. Like I'm sure a lot of people don't have their budget for next fiscal year yet. With our money left over end of the year budget, we're just trying to purchase as much as we can right now, in thoughts that if we're not able to do that next year, for our next fiscal year, we're going to do that. So stocking up on cleaning supplies, stocking up on pretty much anything that we're able to right now. We are in hopefully a good position where enrollment looks like our retention from last year's students looks very good right now. So that's going to help us out. Enrollment is probably going to be down a little bit, just like it probably will be for lots of people, depending on what that melt looks like. And in the last month or so of the summer, we'll see where we're at and how that's going to affect us. Using our budget for next year, we know that we probably will be able to save some money on special events, having to scale back a lot of that. So the thought process is hopefully that some of that money saved, we're going to be able to put back to our students and hopefully have some more student employees that will be able to help keep the building up, the cleanliness up, have certain students stationed around the building where maybe we haven't done before, and have them just be able to help us clean and keep the building as neat as possible. So we don't know exactly what that's going to look like right now. We do know, like I said, we will be able to save some money in certain areas, and hopefully there won't be too big of a budget cut, because we do know that our staffing will probably, the amount of money we spend on student staffing will probably be higher this next year, just because we're going to need help keeping the building clean, keeping everything wiped down. So we'll know, just like everybody else, probably in the next month or so, exactly where it's going to be at. We're trying to do as much purchasing right now, though, for things that we know we're going to need for next school year.
Kevin, can you go ahead?
For sure. So our vice president of operations pulled together kind of representatives from everywhere across campus and just asked us to submit what our needs normally are for a semester and what our needs are predicted to be. And her and the purchasing department are going to pool everything. Everyone submitted suppliers and stuff like that. So we're not, it's kind of the individual budget has gone away a bit. The goal is just to purchase everything we need to get through a semester. And then after that, probably won't get everything I asked for and change my policies and procedures based off of that. But then as well, I anticipate budget just being super strict, where normally I submit and my boss's aide doesn't even look at it and it goes through. Because we're doing that pulled PPE and sanitation, I'm pretty sure that it'll just be super limited. So we haven't gotten a whole lot of specifics on what the budget looks like. But again, it's because the VP of operations decided that our major goal across campus is just to get started, because we all know if you don't have that stuff, you don't operate. And then again, like I said, over like open gyms and rec sports, one of the reasons I kind of pulled the plug on those is, again, anticipating more students needed to operate, fitness center and to do it well. So eliminating some of the student staff in those areas to save on the budget, to make sure we can have just normal hours in fitness and wellness type thing. So again, not a whole lot of specifics, but we're trying to pool the ordering across campus.
Chris, you want to go ahead?
Sure. Much of our operating budget for recreation comes from our membership, our paid memberships. So our faculty and staff purchase memberships. And at this moment, as I looked at it yesterday, we're losing roughly $10,000 a month when we're not open. So that is going to have a significant impact on how we do what we need to do. And there are some things that we do on a regular basis. We typically every year will replace some of our cardio fleet. So for example, this year would have been treadmills. Every third year we would replace treadmills. This probably will get pushed off because that's a huge expense that we're just not going to be able to incur. And sorry about that, Mitch, but that's the case. We're also looking at other ways to reduce costs. As simple as, do we buy pizza with pepperoni, or do we just buy pizza for staff meetings? And I do think that we'll be okay. We just have to be prudent. As far as those things that we're going to need to run our facilities, the PPE, extra cleaning, all of those types of things, we are working hard to align with the other departments on campus. So residential life, dining, library, to look and use the resources from our university facilities to purchase those things, as Kevin said, in a group, so that we have what we need, and maybe those funds from other areas will be used to buy those things that we're going to need, just like everybody else. So that's where we are with that. As far as student staffing, we haven't really gotten anything. The only directive that I've put in place is I've asked that we only hire federal work study students at this point. Prior to this, we've had some flexibility. If we found a student who was just awesome, that we could hire them if they didn't have federal work study. We don't have that flexibility now.
Jen, you can go ahead.
So our budget priorities immediately are getting as much income as we can before the end of this fiscal year that we can potentially roll over or won't hit the budget till next year. So for example, my outdoor ed program can be doing rentals on boats or stand-up paddle boards, and the sailing center can start their memberships. As far as spending, Ian, one of my team members, has done a fantastic job of getting wipes all procured now. He ordered the Alpha HP before we even closed, and shipping time was 6 or 8 weeks. So it was great to be able to have that on hand. So a lot of that stuff's already completed and in, but then getting the rest of the PPE on this year's budget, because like Chris, all of our student membership money is what the fitness center survives off of. And my areas from within physical education, recreation, don't get as much money from the university as the other parts of athletics. So my units will have to be bringing money in order for us to have money to spend. I do anticipate there will be some help from the university at some point because we're kind of all in the same boat. But the biggest budget priorities are going to be to sustain what we can with the staff. I assume too, they may let us, as the school year begins, hire work study students. We'll have to see with that. And having the cleaning supplies and offering as much as we can in our facilities without restrictions, and just keeping hours as long as we can to offer more for our students. Fortunately, we have a 6th facility being built right now, and that construction's still continuing. And so we do feel fortunate it won't open for another year and a half, but we're happy that it's still continuing, because that project could have stopped and could not have moved forward, and we need that space.
Yeah, that's great. Thank you for providing that context. I do want to, before we move on to our next topic, I do want to say that for our participants, don't feel like your questions that you put in the chat need to be on these exact topics. You can ask anything that you're really wondering about. So feel free to put other topics into the chat. Okay, so this next question may apply to each of you in very different ways. So answer in whatever way this does or does not factor into your plans, or to what degree. Are you considering any new or existing technology systems or tools that would make reopening safer or more manageable? Chris, if it's okay, I think we'll come to you first.
Throwing a curveball there, Jess. Good thing I'm paying attention. So there are some things that the university are putting in place for employees. There's training modules that we'll need to use or need to take as staff, that once I take a look at that, I may apply that to our student employees. And there's also a technology that the university, it's an app that the university is currently using called Dr. Chatbot, which was designed at the university, that is basically a quick question. Hey, you click on, before you come into work, you click on it. It asks if you have any of the symptoms. If you have them, you click yes. If you don't, you click no. What I've learned in the couple of times I've been on campus is if you click no, then you get a notice that says you can go ahead and go onto campus. My understanding is if you say, yes, I have some of these symptoms, you'll be directed to call our UHS, and they will, our University Health Services, and they will tell you what to do next. So those are some things from a staffing level. And then we are, along with the library and some other spaces on campus, we are looking at a platform called AccuSpace, which monitors Bluetooth signals, and will be able to tell our students by a quick look, hey, how many people are in the library, how many people are in the gym, dining hall, so on and so forth. So I think that's going to be something that the university is going to invest in. I hope it is, because I really think that'll help students to kind of make decisions about where they want to be, when they want to be there. And then, of course, as far as programming goes, you know, continuing to use Zoom if we need to for fitness classes, yoga classes. We do have a fitness club on campus who has done some of these things throughout the closure. So, you know, we'll continue to do that. And honestly, my hope is that we will be able to do some more in-person fitness classes like Kevin talked about, so that people can get that personal interaction that we're missing. So those are some of the things that we're doing.
Yeah, and were all of those options, the apps that you mentioned, are those ones that students would have to individually download to their phones?
Yes.
Okay.
Yep. And the Dr. Chatbot that staff are using right now, that is something that students will need to do in order to go to class. I'm not a technology person, so I don't know how we figure that out, if they've taken it or not, or if how they've answered, but it is a layer of prevention that we're putting in place.
Okay, I don't remember if we were in any specific order, but I'm going to go to Kevin.
Cool. Yeah. So the university, or soon to be university, switches July 1. College, soon to be university, is doing some similar things with like temperature checks and login and stuff like that. I haven't heard of any plan to do like a campus-wide occupancy. So we use IM leagues for our Group X and our intramurals, so that I'm going to reserve space in indoor track, fitness center, like spin room with that, and then it'll probably just be limited time and groups for that. So that's how I'll keep track of amount of people in the fitness center. So you also know as a student, if there's opening, then you can sign in right away and go, but you also know if it's closed and full. So that's what we're doing there. I'm going to try and make all of our student worker training online. So I was able to get like the same thing that our faculty use to put their classes online. We use Canvas, and so I'm developing student training there now with quizzes and videos, and so hopefully they can kind of go to work under our new policies and procedures without me having to meet with all 50 to 70 of them in groups of 5. So that's really the big technology switch. And because I run our strength and conditioning, we have about 300 to 400 videos of exercises on our YouTube channel for my strength and conditioning software. So we're going to shift that over to kind of more virtual things for general fitness and wellness rather than just our strength and conditioning platform. So it's kind of dabbling all over the place in that one.
Jen, do you want to go next?
Yeah, so in the beginning, one of my team members actually did look at the hydrostatic sprayers to see if that'd be something we want to use. In the end, we decided in the fitness centers, we do not, but we are buying some in the athletic department. So we may use those in the end if they do work with the teams and we think will be beneficial. IM leagues is what we will most likely be using for reservations. We use RecTrack for our member management, but it doesn't ideally work for reservations as we'd like. So my team, with the outside of intramurals who already uses it, sat down and learned that program so we can be using it for reservations in the pool as far as lanes are concerned. We're not going to use it for cardio. I did see this in the question, if you're looking for somebody to do a reservation system for cardio, I had a guy all set up to make one for me, and we didn't follow through because too many other changes were happening at the time, but I can connect you with him. Another opportunity that I think will be good for us is, I can't talk directly to what this program is, but we've been working with Cornell students in the spring. And previously, before we switched to RecTrack, we had a program that was designed to tell students how many people were in the facilities at each time. We no longer have that connected to RecTrack, but there's a new program that I believe starts in September that my team's put together. And that way students can go on our app and see, this is how many people are in there. We know what the capacity is. It's not worth coming now. Those are our main technology things outside the other things people are using with Canvas for videos and stuff like that.
Yeah, someone actually just typed in a question I was going to ask you anyway. For the electrostatic sprayers, what went into that decision of deciding to use it in the athletic facilities versus not use it in the fitness center?
Right. So the big thing that we were looking at it for was more for the equipment, not necessarily the air. And as we've been learning more that it's not living on the surfaces, we decided that it wasn't worth the investment. And the hydrostatic sprayer, we would have to shut down midday, which we will for cleaning, but shut down midday. You have to suit up and have your respirator mask on in order to do, and then you have to let it sit afterwards. So basically what you're doing with the hydrostatic sprayer is really only cleaning the airspace. And if people are wearing masks and taking other precautions, we didn't think that spending the amount of money that hydrostatic sprayers cost and all the training that goes along with it, and then having available staff to do that as necessary, is probably our best bet right now. Okay,
great. Chad, can you go ahead and talk about any technology that you're considering?
Yeah, so we, as a university, we use an app called LiveSafe to push out alerts and anything that needs to go out. That runs through police and safety. But we push that out for any kind of emergency alerts. They are coming up. We're learning about it right now, but coming up with a system where you can do daily temperature checks and daily wellness checks. So what we're doing currently for people that are on campus, that are working with people. So our ground staff, our custodial staff that are on campus trying to get ready for fall semester. All of that's being done right now on paper. So every time somebody comes in, they're staggered shifts now. Within 15 minutes, there's a group of them come in, they fill out on paper, yes, check box, yes or no for symptoms. I think we're going to be able to move that way with our Live Safe app. So we'll be using that technology in a different way as a university. In our recreation and wellness center, somebody mentioned IM League. So we are currently an IM League school. We do use IM Leagues for intramural sports. I'm starting to look in a few other directions just because we're getting a little bit pushback from our students with the amount of ads on that program. So we may be using something like that for to rent out, to reserve our cardio equipment, reserve spaces in the building. I'm not 100% sure what program that'll be yet, but we're exploring that. The other thing we're doing is we're just trying to figure out ways with technology that we're currently using, how can we use that a little bit better? So we use our building management system as Fusion. So before, when we have a parking lot in our building and people come in, they sign in their car, they sign out their car when they leave. Lots of touch points, lots of people gathering around our front desk. So instead of having that binder, we're talking about checking out a parking spot just like how they're checking out equipment. So you come up to the front desk, we'll swipe their card, or they'll tell us their name. We'll be able to say that Sally Smith has a parking spot. She checked in here. So instead of having touch points, people gathering around the front desk, we might go that way. So we're trying to creatively find programs and technology that we're currently using. Might not be quite designed for what we'll be doing in the future, but I think we're finding that if we can be creative with some of the things that we have been able to use, and see how it's going to help us out in the future. With group fitness classes, I know Chris said something about that. We're gonna talk about keep doing those online, at least some of them, moving forward. We've gotten such good numbers with attendance in some of our fitness classes through Zoom, Instagram. We're probably going to keep doing that, at least to start with, and offer those online. So we have found that some of the things that we're doing currently to offer programming to our students, to our faculty, to our staff, to our community members have worked a lot better than what we expected them to be originally. So I think we're going to at least initially keep doing that.
Got it. This is just more of an off-the-cuff question, not one of our pre-selected topics, but are there any non-technology ways that you have in mind to just kind of manage the flow of your fitness center from that first time someone steps in and is trying to check in? Like, are they going to check in, or how are you going to manage that traffic throughout your facility? And any one of you can jump in with your thoughts.
Yeah, I'll go ahead. I'll start. We're thinking completely differently on how we are setting up the building and flow in the building. So we had one spot where we're enter and leave the building. That's probably just going to be entrance only right now. We will exit the building at doors that are generally not available, just for emergency only. I mentioned student employees. I think we're going to completely change how we have our students stationed throughout the building. A lot of times they will do rounds throughout their shift and be stationed at our front desk. So instead of having student employees stationed at our front desk, I'm thinking about buying they're not lecture podium stands, but there's something similar where they can have supplies that they need. So instead of having everybody at the front desk and then going on rounds to do what they need to do, people will be specifically scheduled to man the fitness area, or somebody might be specifically scheduled to stay at the weight area the entire shift. So I think that there might be more defined roles, and instead of just kind of having student employees there having checklists of things that need to get done each hour or during each shift, they might be scheduled to certain spots in the building so that they see if somebody got off the treadmill and maybe didn't wipe it down as good as they should have, they're going to have a bucket, they're going to have cleaning supplies, they can go right away and wipe all of that down. So we're looking at rearranging a lot of what our student employees have done, knowing that their jobs are going to change, just like our jobs have changed in the last few months, and we're doing things we probably never thought we would be doing as recreation professionals or athletic professionals, that the students are going to probably be asked to do the same type of thing.
Anyone else?
I'll jump in on that. We do plan on having flow through our facilities, but our facilities are so tight corridors in certain areas because it was built in the mid 1900s that it is going to be challenging trying to have everyone in one door and out another door. Our students are supposed to sit at different places in the fitness center, which this will really be helpful in enforcing that now and making it easier for them to be at the different ends they're supposed to be at. But for the most part, trying to find every way that we can in and out of pools and locker rooms and gymnasiums, which we don't plan on opening the gymnasium for a while, in one door and out another, so we're not having that cross. But I think as far as inside the fitness facilities themselves, it's going to be very challenging. It's going to be like going to the grocery store and keeping people away from each other.
Yeah, I would echo what Jen just said in that, we operate out of a building that's quite old. And our university, honestly, is not as concerned about traffic patterns across the university. So we feel the same within our facility. We do have a one entrance exit door, and to get into the entire facility, you have to go through some narrow spots, but we are being educated by our medical professionals that a quick pass in the hallway by two students is not a big deal. It's when they become a group of students, and how to manage that is more to what we're focused. And with all of that said, we have thought through if we're asked to provide different traffic patterns throughout the facility, how we would do that, what doors we would choose, what paths we would take, but that's not something at this moment we're being charged with.
I'll jump in quick. There's been a lot of conversations with my boss's leadership team on just the fatigue on students and employees of all these rules and regulations. And at a certain point, how are you going to police all of it? So it's I have a lot of different working documents of, hey, if you never want them to cross paths, then yeah, we have to open these doors or that. So I have a couple of different options, and a lot of other departments are doing the same things and just trying to come eventually with a middle ground of, at some point, you're going to create too many rules that are impossible to enforce, and then everyone will know that rules aren't enforced, and it kind of falls apart. So that's what a lot of like the leadership team on the co-curricular side is talking about. Like, what do we really, again, with our medical staff, what do we really want to enforce? How are we going to be able to do that with staff hours? And so I have like 3 or 4 of those options, again, opening up emergency exits, really getting limited on booking and having a gap time between groups coming. And again, it just becomes how much time do you want me to spend doing that? And I'll respectfully obey with what leadership tells me to do.
Okay, great. Thank you for the insights each one of you shared in response to those questions. Right now, we can shift gears a little bit and turn our attention to the chat to open up our question and answer session. So if you have questions on these or any topics really related to reopening, we invite our participants to type those into the chat and continue submitting those if you haven't already. And we'll do our best to cover all these topics as much as we can. So at this point, I'm going to pass the moderating duties off to Josh Arnone to go ahead and ask some questions that have been submitted into the chat. So Josh, take it away.
Thank you, Jess. If you could get your attention on the chat section, we're just going to ask a couple questions and address the questions that were put into this meeting. So if the roundtable's been helpful, you'd be interested in having another one, type yes or no if they're not. And the second question is, if you'd like to have another one, would you like it to be sooner or later? Sooner being like 2 weeks, later being maybe a month from now, sometime in August. We're really looking for the proper timing and happy to host as long as they're beneficial. So we just want to make sure it's timed well, not inconvenient for anybody, and we don't want to do them if they're useless. So please just give us that feedback within the chat, and that would be really helpful for us to plan with all these. But to answer specific questions in the chat that came through both privately and publicly on the chat, number 1 was, do you anticipate suspending any aspects of your operation for fall semester, for example, intramurals? Some of you answered this already, but I don't know if there's a comprehensive list that you could each go through. Just feel free to jump in. Doesn't matter if we have to go in any order, but just go ahead and let me know if you're suspending operations on anything. And we could kind of go Chad, Kevin, Chris, Jen. Boom.
Yeah, I guess we don't know exactly yet what we'll be doing with a lot of our programming. Like I said before, I know that we are going to probably be more restrictive when we first open the building and then hopefully loosen after that. So I don't foresee us doing a whole lot of programming initially. I think a lot of our group fitness classes are still going to be done online, again, at least initially. If we do offer some, I think we're going to just be creative in how we offer them. So maybe we'll take the spin bikes to the basketball court. So we'll do a yoga class outside in the grass. So as for intramural sports, I'm hoping we're going to be able to do something with intramural sports. It's probably going to look different than what it did before. I want to do something more than like an esports. I do want to get people off devices, out of their rooms, and hopefully be able to offer something. I don't know what that's going to look like quite yet. For our sport clubs and those kind of programs, I think we're going to rely a lot on what the NCAA finally comes down and says. I know that they've come out with some restrictions. I know our sport clubs are also going to be either limited by what their leagues and organizations say too. So we will have our own policies, procedures on traveling, on doing those types of things at Gannon. But then ultimately, if Gannon says that we can travel somewhere, but the leagues say, no, we're not going to have games, then we're going to follow those guidelines with sport clubs. So a lot of that's up in the air right now. We're mostly focusing on getting the building up and running, trying to figure out what that looks like, and then see how that goes, and then reevaluate a lot of that almost on a daily basis then.
Yeah, so again, given what the NCAA and NATA, National Athletic Trainers Association, has come across in the resocialization of sport and just how complex and strict that is, we've decided that rec sports and intramurals as we do them now probably won't happen. And so better to kind of rename, rebrand, and come up with a different kind of non-traditional way of getting some of that competitive outdoor single person competition or whatever. Our group exercise room is really small, so we'll probably close that down. And again, just spread out some of those classes, again, like boot camp classes in the indoor track with shared equipment in their own kind of station, so it can be sanitized each time and you're not sharing things. So, but basically, yeah, intramurals, open gyms, probably not for the fall. That hasn't been officially approved yet, but I've pushed for it.
Yeah, Rochester, again, we are certainly following the university guidelines for social distancing, and that's something that we're considering as we go through all the activities that we may or may not have available. We are only closing one space, which is a small dance studio. Otherwise, everything will be open, but we will restrict what kind of activity will be in there. So, for example, at the squash courts, we'll allow somebody to go in and hit a squash ball around by themselves, but we won't allow game. Same way with basketball, which in a way, I feel like I'm opening a can of worms, but if somebody wants to go and shoot, I'm okay with that. Play 3-on-3, we're going to have to monitor that. I just think it really is going to take a little bit of time to look at what we believe will happen. Hopefully our students will be on board. They will have lived through this pandemic for several months and have to social distance. So hopefully they can apply that as we ask them to in the athletic center. We won't have to restrict what they need to do for too long. And then as we move through using all of the guidance from the university, from the state, NCAA, NERSA, whatever professional groups we can pull from, we'll phase things back in that may look a little bit more normal to what we know. But I do think we're going to have to be really creative in intramurals and programming that we offer, doing some pop-up classes outside, those types of things, just to keep people engaged.
To start, we don't have club sports under us, so I don't have any answers about what will happen with them. For the rest of my programs, all programs will be adapted at some point, so we don't have to cancel any. The only big change students will see will be in our gymnasiums, because most likely physical education does fall under me, and we have a PE requirement with 460 PE classes a semester. A lot of those classes will have to be spread out, so our gymnasiums will be used primarily for that. and we won't have open gymnasium time at this point.
All right, thank you. Our next question is, can anyone recommend an app or online reservation system for patrons for cardio and fitness equipment? If that is IM Leagues, what exactly does that reserve? For example, can you reserve, treadmill number 1 or dumbbells in a certain weight increment, selectorized equipment? And is there a time frame within that? Basically, if you're doing IM Leagues, what does that look like for a reservation system? If you're using IM Leagues, I guess it's a preference to start for a panelist if you're using one. I'm not exactly sure who is or isn't.
So we do currently use IM Leagues. Like I said, I haven't explored a whole lot about what that looks like. I do know that they are offering something. When we do some sort of a reservation system, it will be specific to, probably it will be, depends on the area. So I'm thinking our cardio area, it will be specific to the piece of equipment. So we know we have X amount of treadmills available, and then you will reserve a treadmill or you will reserve a bike. In our weight area, and they are a little bit separate, we're not going to be reserving specific equipment in the weight area. You might reserve an hour in that area to get your workout in. I just don't think that it will be feasible, and it'll be difficult to monitor to reserve individual pieces of equipment where you might just use a leg press machine for 5-10 minutes and then need to move on. Where in the cardio area, you'll be able to reserve a treadmill for, say, an hour so you can get your workout in. So depending on what area we will be in, that's going to be dependent on how we use the reservation system.
We currently do use IM Leagues in intramurals, but we will not be using it for reserving fitness center space. It will be for other reservations that we need, such as equipment, and not equipment even in the fitness centers. But as I said earlier, if you are looking for a system, I know the guy that I was having build ours was building it off of a parking system, and it would assign you to the treadmill and you could just put your time in and do it. But I think right now we have enough to deal with that reserving machines is probably more than what we can handle.
Yeah, I don't think I was going to be able to do individual machines. I run all of our IM Leagues for our group exercise, and even getting that uploaded is a bit of a nightmare. I like IM Leagues, but it's sometimes hard to deal with. So I thought, just reserving spaces and, again, spreading to the indoor track and moving certain equipment there, so you could reserve indoor track or cardio in the fitness center or weight in the fitness center would be still a huge task to upload well. And again, it'll be interesting to see how it goes, because there are some member complaints already using IM Leagues on that back end. So, but that's what I have to use. So.
Yeah, and I would just chime in that we currently reserve, our users reserve space on the tennis courts, and that's a nightmare in and of itself to manage. At this moment, I'm not looking to reserve treadmills or anything like that for our students. I mean, I'm thinking about it in our more busier times. I mean, there's really not a point at which we exceed a capacity that wouldn't allow people who want to come in to use a treadmill or to use weights or whatever the case may be. So I'm thinking about it around our more busier times. But I feel, again, similar to Jen, we've got a lot to manage day to day, trying to figure out if the person on the treadmill is the person that reserved it, and that, I don't know. It just seems like something I'm not comfortable with yet, but I'm certainly thinking through it, because I don't want to make it a horrible experience for our users or for our staff.
Okay. It's going to be a kind of combination of two questions. Will the community be able to buy passes for the fitness center or pool? If the community or outside memberships are allowed to do that, how are you planning on keeping distancing or lower occupancy between those community members and students? So that's kind of a loaded question. It's a lot, I know. But outside memberships, how are you going to kind of police that between students and community?
Yeah, I can go on this. Like I said, all of the operational money that we receive are from our memberships, faculty, staff, community members. And I know everybody here will keep this silent, but at the moment we are seriously considering only opening at first to students. So, we're making a conscious decision not to have faculty and staff or community members come on our campus initially, just again to keep our circle kind of small. And then as we move forward, opening up to faculty, staff, and then adding into communities. And again, it's all going to be based on our ability, our students' ability, our users' abilities to follow our guidelines, social distance, and do what we need to do in order to have that happen. We won't sell any new memberships. We won't permit guests to come, so student guests will not be able to come into the facility. We have a turnstile system where students have to swipe in, so you have to have your ID card. That's for contact tracing if indeed we're asked for that. So a student coming without an ID card used to be able to, argue a little bit with the student at the front desk and get themselves let in. That's not going to happen. It's not possible because of the health and well-being of our community.
Yeah, we're kind of in the same boat. We have community members as well. That's not our only operational budget that we have, but we have a fairly substantial amount of community members that use our building. And we're probably going to go the same route. Well, I foresee us opening the building initially to students, faculty, staff, see how that goes, see what the usage numbers are to see if we do have capacity to allow more people in the building. Once we do that, we'll be allow our current members back into the building so they can use that. Probably not sell new memberships at that point, no guest passes, kind of the same thing that Chris was saying. Again, once we see that if that is working, we still have available spots and people are able to use we have available room in the building to accommodate more people, then we'll look into start selling more passes. Again, and I've mentioned it a couple of times now, what we're trying to avoid is allowing too many people in the building and then having to allow our members to come back and then a week later say, hey, it's just too busy right now. We apologize, but we're not going to be able to accommodate you at this time. So I think we will end up with more customer service issues by going that route rather than just slowing down and opening the building in a few phases. So.
All right. John from SUNY Delhi had a lot of questions about the pool. What are you using for ID check-ins at the pool? And I'm getting to the chat now to look up those specific questions. So ID check-ins at the pool, when we're in there, sorry, a little time to load. And will the community be able to buy passes for those? We already answered that. John, I am going to give you information on a guy from Penn State Harrisburg campus Craig Murphy is really sharp on a lot of the pool and aquatic stuff. So I'm going to connect you with him too. But if anybody has answers for that as far as pools go, I'm not the best guy to answer questions on pools. So please, our panelists, jump in if you could.
We use RecTrack and we have handhold scanners. So with the handhold scanners, the lifeguards can do it on deck. I don't know if we will do that or not. We have another way of scanning them at the main entrance. We haven't discussed it. Being in New York State, my thought is actually with all the pool questions as I was reading them, and this has been my thought all along with hair salons and other things that have become open, I think the state's going to give us a lot of regulations on what's required. But my plan currently is not even to let them use locker rooms in the beginning. They'll come in through an outside door. Their card will be checked through the guard, through RecTrack at the pool, and then they'll have to leave through the outside door.
Okay. Okay. Next, we had an email question, and that was temperature check-ins. Do you feel comfortable with having students do temperature check-ins? Are people going to be checking temperatures? What exactly does that look like? Is anybody thinking about that on our panel? And who's doing the temp checks, and are students going to be allowed to do that?
I can jump in here. Again, I'm going to follow university guidelines on that. You know, if they're checking temperatures for students going into the library and the dining hall and the residence hall, maybe that's something that we would need to do as well. But at this moment, I'm not hearing that we're doing that at each entrance to the student union or anything of that nature. And as far as implementing it, if we had to, I don't know how we would do it. I'm not sure I'm comfortable with putting students in that role. So I'm not sure how we would do it if we had to do it.
Yeah, I'll jump in there again, talking to our director of sports medicine, like what they have to do to check in athletes to practice and stuff like that, talking about like changing gloves each time and multiple, it seems really complex. So again, well, I'll wait for the university, but it seems like it would probably not happen to go into the common areas, just daily reporting symptoms and temperature checks like other individuals have said on a common app, and then following hand sanitize when you come in, when you leave, wipe down the equipment before and afterwards. I'm going to push really hard for that versus training. I'm the only professional staff, so it would be my work studies doing all of that, and I think it'd be better to avoid that. But again, just waiting for the university.
All right. This has been a common one, are you going to have students or anybody in the facility wearing masks? And if you are, what does that change for you as far as signage or any other kind of warnings or anything like that? So are you doing the mask requirement? And if you are, what does that change for you on the ground?
This is going to sound repetitive, but we'll look to the university to direct that. My initial thoughts from what they have sent out, what the university has sent out, is that our student employees will wear masks. They will have gloves available. We will have shields available at the front desk, the fitness center, where there's some stationary spots where they do their work. As far as masks within the facility, as they're moving throughout the facility in the main hallway, coming through the turnstiles in the lobbies, going down to the rec courts, I can imagine that the expectation would be, as it will be across campus, is that they wear a mask when they're actually on a treadmill, something of that nature. Our athletic trainers are suggesting that that is not a good idea to require that. We may have some students who want to do that. That would be their choice, but that's not something that I believe we will require.
We
Yeah.
will. Go ahead.
Sorry. Go ahead, Jen.
We will require masks. We'll require them everywhere in the building. If you are sitting in your office by yourself, I won't require them there, but otherwise, after discussions with my team and with the university, that masks will be required. And I'm hoping actually, while we have the weather we do, people go outside instead of trying to be on a treadmill, because I can't imagine being on a treadmill trying to run with a mask on.
Yeah, I'm a mix of both of those answers. So I think ultimately that's going to be probably more of a university decision. My viewpoint is, I guess I would follow a little bit what Jen was saying, is personally, we're finding out more and more that this transmits through air, more so than what they thought on surfaces. So if it was up to me, I think that, yeah, making masks required throughout the building, I think, is the safest way to go. A lot of that's going to depend on the NCAA, though. So like I said, we have a shared facility, so there could be a time where we have our basketball team or our volleyball team practicing on one of our courts. And if they're not wearing masks, it's going to be pretty hard for us to be able to police to our students, our non-athlete students, community members when they're in the building, to say, hey, you guys need to wear masks, but our athletes, our NCAA athletes, do not need to. So I think it's going to be a combination of what our leadership team says throughout the university, what the NCAA ends up doing, and then I think that's when we'll have to follow ultimately what they say. Personally, I think that it's probably a good idea to wear them. I know that there's going to be some difficulties and people not happy with that, but just knowing that how it spreads through the air more and more, I think that it's important to, it would be safer that way.
All right. I had some conversation I had yesterday about masks. I think the NSCA put out some guidance on that. And it's helpful to look into. I'm sure that we could send that out within our follow-up email. But it had a lot of stuff to do with masks and heart rate, and if you're above 50% max heart rate or below, when you should or shouldn't wear a mask. So if that's helpful, we'll send that out. But we're getting really close to our time limit here if there are no more questions. I haven't had any more in the chat, so thank you panelists for your responses. In the next few days, we're going to send out an email to all the registrants with a link to the recording of this so everyone can access it. You also have access to the chat. And if you have any follow-up questions, you can reach out to us any way you can, to your rep at Advantage, to our chat directly. It's no problem. I think we had one thing maybe coming in for a question, just going to make sure that it's not. And if not, that's okay. Nope, we're good. And once again, thank you for all participants and joining in, and especially the panelists. You guys did great. And with that, have a safe and happy weekend. All right.
Thank you. Bye, everybody.
All right. Bye.